The Office of Student Wellness is housed within the New Hampshire Department of Education and is committed to the development of the whole child. We work in collaboration with local communities, school districts, and individuals to support students as they become productive members of society. Our vision is, we envision a system that creates optimal social, emotional, and educational outcomes for all children. We stress all children and youth from birth to age 21 and their families and at all levels of need, from those with relatively low risk who are thriving to those with the highest needs and risks. This module is a presentation of our New Hampshire framework for multi-tiered systems of support with a focus on behavioral health and wellness. We call this framework MTSS-B. We will talk about why it is an effective and efficient framework to put in place. Why should we be addressing and supporting behavioral health and wellness in schools? Research shows that for students to fully engage in academics, they must be present and ready to learn. They must feel safe. They must feel cared for as people first. They must be comfortable and confident in their ideas and opinions and know that those ideas and opinions are valued by the adults around them. They must build and demonstrate leadership skills and their ability to work with others as part of a team. Developing a comprehensive framework for supporting student behavioral health and wellness will allow our schools to better serve each student. We know our schools reflect and must respond to a variety of issues and challenges in relation to our communities. For example, we know that the health and wellness of a family and its children are highly impacted by the economy and the resources available to the family, the way the family members have learned to interact, and the strengths within that family. Then there are the strengths and resources within the school environment, including the school's culture and norms, the strengths of the school community, and the relationships within the school. When the response of the school is unpredictable, it makes learning much more difficult, especially for children who have social emotional challenges. There is much to consider in addressing both the needs of the school and the families within the community. Some of these include varying levels of achievement, varying levels of engagement, varying levels of ability, staff turnover, complex and limited funding, competing initiatives, standardized testing, time and scheduling, mental health wellness and access to support, food insecurity, alignment of family and school schedules, unique family dynamics, varying degrees of school readiness, and responsiveness to diverse cultures. Schools can be a place that focuses on a growth mindset by promoting all children to explore their strengths, create lives filled with hope and a future orientation, and provide the opportunity to learn social skills for lifelong success. The Office of Student Wellness highly values and engages in strong collaborative partnerships, not just at the state level, but by engaging stakeholders on all levels, from the student to family, community, region, and state, with the student being at the center. Collaboration is about working together and sharing common vision, resources, goals, and outcomes. We cannot do it alone. Just as the African proverb states, it takes a village to raise a child. Systems change cannot happen in silos. Why use a multi-tiered systems of support framework? It supports all students at all levels of need, beginning with school-wide universal prevention. It is not a program or an intervention. It's a systemic framework for doing business, helping to align multiple initiatives and resources. It is a proven and effective framework that has been the public health approach to create a system of care. It is prevention-oriented, addressing the behavioral challenges earlier. It focuses on data-based decision-making to be more efficient and effective with the time and resources in addressing the needs of the system. The Office of Student Wellness is promoting MTSS-B because it has been shown to be effective. There is a well-developed set of strategies and assessment tools that allow for effective implementation. At all times, we are focused on what is happening at the student and family level. MTSS-B is focused on the outcome, improved behavioral health and wellness for all children and youth. That means that administrators, teachers, and other school staff are supported to implement the practices that have been identified to improve the behavioral health and wellness of children and youth. In order to do this, the school personnel need to be supported by their district to learn new practices and put them into place. Districts need state policies and resources to support them in this effort. And finally, this entire process is enabled by federal policies and resources that are used by the state. This alignment is happening at the State Department of Education with the creation of the Office of Student Wellness and collaboration between the New Hampshire Department of Education and the New Hampshire Department of Health and Human Services to align their policies and funding. You may be familiar with the triangle as it applies to various tiered supports in education, such as response to intervention, positive behavioral interventions and supports, or even the pyramid model. MTSS-B is based on the critical features of these models by offering a continuum of supports for all students that includes behavioral health, mental health, and academic achievement. All three areas are critical because we know we cannot separate these things. It is about the whole child. Many educational systems are already using a structure similar to multi-tiered framework. Academics, for example, provides a universal curriculum for all students. For some students, they receive small group instruction for a short duration of time based on need and skill level. A smaller percentage of students who are at high risk of academic failure receive individualized curriculum delivered perhaps one-on-one. PBIS is another example. PBIS is not a program, but a framework of multi-tiered supports for positive behavioral interventions designed to teach clear, consistent, school-wide behavior expectations for all students, providing targeted group-based behavioral interventions for those who need more, and then for a few resource-intensive, individualized behavioral interventions who have chronic behavior concerns. MTSS-B is an expanded framework to offer evidence-based curriculum for all students for improved social-emotional wellness and academic achievement, while partnering with community resources and agencies throughout the continuum. This framework is a way for schools and mental health systems to collaborate and improve their outcomes for all children and youth, especially those with or at risk of developing mental health challenges. In looking at tiers, we can see the green foundation of the triangle, commonly referred to as Tier 1, universal or primary prevention. This foundation provides implementing high-quality instruction for all students and staff and across all settings, focusing on prevention. When implemented well, Tier 1 support works for over 80% of all students in a given school. It is important to note that all students, regardless of need, receive all universal strategies. Highly effective universal interventions in the early stages of implementation show strong empirical support for their effectiveness with at-risk students and can affect an entire school community, climate, and culture. Universal interventions support best learning for all students. Examples of this include having clear and consistent school-wide procedures and routines, proactive and positive classroom management strategies, embedding social emotional curriculum and high-quality academic instruction for all students, teach and recognize expected behavior, and having a continuum of strategies to respond to behavior. The second tier in the yellow represents approximately 10 to 15% of the student population who need additional supports, sometimes referred to as secondary prevention tier. Delivering targeted small group interventions, matched and based on the needs of the students, is critical in being proactive, reducing the frequency and intensity of need. Targeted or Tier 2 interventions give students more opportunities to practice the universal strategies that are delivered through Tier 1, with more concentration and focus on the targeted skills needed for them to be successful. Some examples of Tier 2 interventions are check-in, check-out, social contracting, simple functional behavior assessments and behavior support plans, social skill groups, self-regulation groups, and specific academic skill instruction. The red tier, or Tier 3, represents approximately 1 to 5% of students who are in need of specialized individual interventions for high-risk behavior, often referred to as tertiary supports. These are interventions designed for students with significant needs. The interventions at this level are explicit, focus on remediation of skills, and are provided for a longer duration of time in very small groups or individualized. Examples of these interventions may be cognitive behavior therapy, comprehensive functional behavior assessments and behavior support plans, and wraparound services. There has been a highly organized effort in New Hampshire, led by the Office of Student Wellness, to articulate what MTSS-B is so that districts and schools can implement it more efficiently. A stakeholder group that includes representatives from districts and schools, community mental health and other behavioral health policymakers, university staff, cultural and linguistic competency experts, and MTSS-B trainers have developed this definition of MTSS-B in New Hampshire. Please refer to the guidance document, New Hampshire MTSS-B, in the Toolkit. We know that students have a variety of needs. Often there is an array of supports and services that are already being done with students who have varying levels of need. At times, they may be intentional and part of a structured delivery of interventions throughout a continuum. Other times, they may not be. We know that best practice is to have a strong foundation of proactive, universal strategies to support all students. We know that there are groups of students who need a little extra than those with very intense needs. Often we are reacting and putting out fires, which is not efficient and on the long run, not often effective. Staff are being taxed, families are feeling stressed and disconnected, administrators and school counselors are spending precious time intervening so teachers can teach. In the community, there are multiple reasons that make access to receive much-needed mental health services challenging. Intentional creation of a multi-tiered system of support by layering a continuum of services within a seamless service delivery model and implementing proven practices and interventions at all 3 tiers by infusing mental health supports from our strong relationships with our community mental health centers is an effective and efficient way to provide needed resources for all students and families. This includes providing ongoing professional development for staff and our community partners, engaging families as partners, having a good data collection system in place for data-based decision-making, and ongoing coaching and technical assistance. When these pieces align, then there is a solid framework in place to support families, youth, school staff, and community members. When PBIS and school mental health systems are operating separately, The results are a disorganized delivery of system and contributes to a lack of depth in programs at Tier 2 and Tier 3. By joining together, synergies are unleashed and the likelihood of achieving depth and quality in programs at all three tiers is greatly enhanced. Our model for New Hampshire brings partnership and collaboration as a core element to this framework. This means connecting families, schools, and communities, and collaborating with community mental health centers and community organizations. This model is also supported by core features of PBIS. This includes evidence-based practices, team-driven shared leadership, data-based decision-making, and progress monitoring for fidelity and impact, and ongoing coaching. New Hampshire MTSS-B framework also embeds the research elements from implementation science to help schools and districts have greater implementation success. Research shows that if done with fidelity, it will improve the social and emotional skills and preparedness of children birth through 5 years. It will increase protective factors and in turn increase resiliency. It will improve mental, emotional, and behavioral health of children and youth and behavioral health outcomes of the highest need children and youth and their families and caregivers. It increases engagement in families and youth at all decision-making levels. It improves school climate and culture, all impacting increasing academic performance. MTSS-B will substantially reduce risk factors that lead to academic failure, substance misuse, problem behaviors, and school violence. It will reduce the need for punitive exclusionary discipline practices such as suspension. It will reduce the time teachers are spent handling problems that are disruptive to learning. To review, MTSS is a framework with similar features to other frameworks such as RTI and PBIS. This means that MTSS is not a program, it's a way of doing business. One example to highlight from a middle school grew out of their concern that too many students were skipping core classes. Steps they took to remedy this was establish a universal leadership team and compile the data about tardies and absences. Develop common expectations around attendance. Teach all students about the importance for going to class. Recognize students for improved attendance. Track the data and celebrate school-wide. There are a number of studies that have shown that this framework is effective at helping students to learn new skills and improve the foundation for learning. This is an example of data from one New Hampshire school district that began implementing their MTSS-B initiative 3 years ago. Planning began in 2013, with implementation beginning in the fall of 2014. This visual shows the office discipline referrals per 100 students in 5 schools between 2013 and 2016. Overall, there's been a 54% decrease of office referrals since the beginning of implementation, resulting in an increase of instructional time. 134 days of total instructional time gained and 64 days of administrator time gained. Another result of MTSS-B implementation has been improved school climate in Concord, Rochester, and Laconia school districts based on pre- and post-survey results, as well as improvement in family engagement and reported substance misuse is trending down. All factors critical to improve academic achievement. At this point, you still may be exploring whether MTSS-B is right for your district or school. You may be inclined in one direction, but probably have more questions. You have just listened to a basic overview of New Hampshire MTSS-B, but there are more steps in the exploration phase to assist you in making a decision. Continuing with the next few modules will help you decide if MTSS-B is the right fit and need for your school. Keep in mind The MTSS framework is about creating a community of support for all students, bringing the community together to plan, problem solve, and share in resource development to better serve the behavioral health and wellness needs for all children in our communities. We hope you move on to explore other modules in the toolkit, as well as testimonial and guidance documents that accompany each step. As always, we welcome any questions you may have along the way. Congratulations in finding our website. We want to be sure that you are aware of all the ways that you can connect with us. We are on LinkedIn and Twitter. We also have a listserv that you can sign up for on our contact page, in a mobile application for reviewing and signing up for trainings or requesting to host one. Thank you.